afternoon. I'm Lou Mastro, President and CEO of Edward-Elmhurst Health. We're pleased that you could join us today for our virtual town hall meeting. We are all very much looking forward to hearing what's on your minds. But before we begin, I'd like to introduce the people we have in the room with us today. Dr. Sanjeeb Khatua is the Chief Medical Executive of the health system and has served as the Incident Commander of Edward-Elmhurst Health's response to the coronavirus pandemic. Dr. Jonathan is a specialist in infectious disease. He takes care of patients with coronavirus and has been invaluable in advising us throughout our operations. Dr. Al Kandel is a specialist in pathology and the medical director of the laboratory at Elmhurst Hospital. He can tell you more about this, but we're very proud that Edward-Elmhurst Health has one of the few hospital labs in the state that is capable of doing our own COVID-19 testing. Dr. Ankur Singhal is an internal medicine specialist and a hospitalist at Edward Hospital. He has worked on the front lines treating many of our patients who have been hospitalized with coronavirus. And Leanna Plotke is a nurse and the director of patient care overseeing the critical care unit at Elmhurst Hospital. She provides critical support for our staff and patients. We are also extremely honored to have Mayor Steve Morley of the City of Elmhurst and Mayor Steve Chirico of the City of Naperville joining us this afternoon. Our health system has been extremely fortunate to have such strong partners in local government supporting us along the way as we have prepared for and responded to this outbreak. We thought it would be important to hold this meeting today so that we could give all of you who are on the phone an opportunity to ask questions during what we know can be a confusing time. You can submit your questions in one of two ways. Either email your questions to covid@eehealth.org, that's COVID@eehealth.org, or type in your questions using the chat function on the WebEx. Dr. Khatua and I would like to begin with a brief overview, and then we'll turn it over to all of you. The coronavirus pandemic has rocked our world. There is a lot of misunderstanding, anxiety, and fear associated with this disease. In our lifetime, there has never been a global pandemic and an emergency response like this one. But I do want you to know that I am seeing the same dedication, the same fidelity to professional oaths, and the same commitment to deliver on the promise of effective, compassionate care that we have always made to our patients. Our healthcare workers across the system are coming together to do whatever it is that needs to be done. While so many stay at home and shelter in place, our healthcare workers willingly come to work every day to take care of all of our patients, including those with coronavirus. From the start, our priority was the safety of our patients, our staff, our physicians, and the community. We moved early and we moved quickly to reduce the spread of disease. We closed hospital departments in our fitness centers and stopped doing anything but the most essential surgeries and treatments. We established coronavirus hotlines, triage nurse phone lines, and telephone or video visits to take care of those individuals who have healthcare needs that can be handled without coming to the hospital or the physician's office. We limited visitors to the hospital, which of course has been very difficult for our patients. We check the temperatures and screen every individual who comes through the hospital doors, including our physicians and employees. Everyone in the building wears a mask. A large part of our workforce has been working from home. For essential healthcare workers that must come to the hospital, we provide options for child care, alternative housing for direct caregivers living with vulnerable family members, areas for quiet respite, on-site emotional support from Linden Oaks counselors, and food, lots of food. You've seen on the news that there is a shortage of PPE, personal protective equipment, such as gowns, gloves, masks, and goggles. Our teams have worked creatively to obtain PPE, sourcing every possible alternative for acquiring these critical supplies. The outpouring of support from our community has been overwhelming. We have received PPE from doctors, dentists, construction companies, the school districts, Chinese American citizens, and other special interest groups, businesses, and so many other friends and supporters. The community sends food to our workers at each hospital every day. And our corridors and break rooms are lined with cards and notes of thanks from adults and children. I have never been prouder to be a healthcare worker. I have never been so inspired by the creativity, passion, commitment, teamwork, hard work, and sacrifices of a team. Edward-Elmhurst Health staff, they are my heroes. For information on how you can maintain your physical and mental health, and for the latest information on what we're doing about coronavirus, please go to our website, eehealth.org. Lastly, I want to thank the Governor, Mayor Morley, Mayor Cherico, and all our legislators who have taken quick and decisive action to help us secure needed supplies and to provide the regulatory and legislative relief needed to respond rapidly to coronavirus in Illinois. This time, I'm going to turn it over to Dr. Sanjeeb Khatua, our Chief Physician Executive.
Thank you, Lou. I wanted to give a few more details as it relates to our preparedness and response. It's important that we share that we have and will continue to take our lead from the Centers of Disease Control and the Illinois Department of Public Health. There is no denying that we have faced some big challenges. National supply shortages, including the shortage of COVID-19 testing materials. Also, the speed at which the CDC and the IDPH and researchers update their recommendations based on new information. We're also closely watching COVID-19 statistics and what is happening in other areas of the world, such as China, Spain, Italy, and even closer to home, like New York, Seattle, and California. We have learned much from their experiences to improve the situation in Illinois. At Edward-Elmhurst Health, we have prepared for a significant surge in hospitalized patients, and we've established the policies, procedures, and treatment protocols needed to provide expert care for individuals hospitalized with coronavirus. We have identified how to expand our bed capacity, increase the number of mechanical ventilators and other equipment needed, and provide additional staff as necessary to take care of rising numbers of patients should that occur. Our medical staff leaders have engaged hundreds of physicians to address care management, patient placement, testing protocols, employee health and wellness, equipment and facility strategies to accommodate surges, infection control practices, and many other issues. They work closely with our pharmacists to secure needed medications. Beginning in March, we established a virtual command center. In hospitals, command centers are open during times of disaster or public emergencies. They have always operated at a physical location, but due to the unique needs of COVID-19 and social distancing, our command center is a virtual operation, operating primarily through teleconference huddles and meetings. Social distancing during a crisis is the antithesis of what healthcare workers do. Amidst all the rest of the chaos, we've had to adjust to this new way of doing business. The Illinois Department of Public Health publishes confirmed cases daily for each county in Illinois. As of today, there have been 1,864 confirmed cases in DuPage County and 1,736 confirmed cases in Will County. We treated our first patient on March 12th, a woman in her 70s who had been an inpatient at Elmhurst Hospital. Since then, we have treated 370 inpatients in our health system, of which 319 have been treated successfully, and unfortunately 51 have passed away. Today, we have 55 positive COVID patients at Edward Hospital and 60 positive COVID patients at Elmhurst. With that, I'd like to turn the meeting over to those of you on the phone line so that we can answer your questions.
I think I'm going to direct this first question to Dr. Khatua. What would you say have been the health system's greatest challenges?
You know, I would say the two biggest challenges for the organization is personal protective equipment and procurement, as well as testing supplies. I'll let Dr. Kandel talk about testing, but I'll speak a little bit about personal protective equipment. Throughout this pandemic, you know, we have had difficulty obtaining personal protective equipment, which includes goggles, masks, gowns, as well as gloves. In particular, N95 masks, which we use when we actually see COVID patients, have been difficult to obtain. There's been a lot of factors that have contributed to the shortages. First, hospitals have used a just-in-time process for ordering supplies rather than maintaining a huge amount of supplies in warehouses. This has been what most hospitals have done over the past few years. You know, much of the PPE that we use is manufactured in China. As you know, they've been fighting this pandemic as well, which has put a halt to their supply chain. Additionally, with the Chinese New Year, factories were closed for a few weeks, which also has led to some of the issues that we talked about. And then also production is behind, and the demand worldwide has skyrocketed as this pandemic is worldwide. So as you continue to see new hotspots around the country, you're going to see the need and demand for these supplies increase over time, which is going to make it more and more difficult for us to procure these supplies. We have done everything we have been able to procure supplies in many different ways, to which Lou has spoke to before. We've also implemented different ways to conserve and use PPE. This includes looking at how we see patients in a different way and making sure that we limit the number of people that actually go into rooms and using technology to communicate with patients rather than unnecessarily use personal protective equipment when not needed. We have looked at different ways and used different ways to decontaminate PPE, as well as purchasing laundered gowns so that we could reuse them in a safe way. I'm going to let Dr. Kandel address the shortage of testing.
Yes, I think it's important to understand that there is a worldwide shortage of COVID-19 testing capacity, which limits our ability to fully understand everything we would like to know about the COVID-19 pandemic and its spread. Testing is important because it allows infected people to know that they are infected and to ensure they take measures to reduce the probability of infecting others. Testing is also essential for an appropriate response to the pandemic. It allows us to understand the spread of the disease and to take evidence-based measures to slow down the spread of the disease. Because of this limitation, even the best existing research and data is preliminary and will be continually revised as the pandemic progresses. We can only provide information on the number of confirmed cases. In other words, individuals with laboratory confirmation of COVID-19 infection. But it's important to remember that this is only a very small subset of the total number of cases in the community. Because of the shortage of testing material, only the sickest patients, for example, hospitalized patients and patients with severe symptoms, are prioritized for testing. This means that when you hear about the percentage of people testing positive, it's an inflated number. The actual percentage of individuals in the entire community who are positive is likely much lower than the numbers you're hearing.
I've got a question that's come in that's really kind of a follow-up to the lab question. What criteria are we using to decide who does get tested, and is anyone who meets criteria being turned away due to a lack of available tests?
So this is Dr. Khatua. So we do have criteria on testing. As we've been able to ramp up our ability to test and the testing kits that we have been able to attain. We initially started with patients that were going to be admitted to the hospital and the ER. Since then, we've expanded it to the ambulatory network for our physicians that have affiliations with our hospital. We're also working with the state to be able to provide testing for them as well. So as our capabilities expand, our testing criteria that we have for our patients is expanding as well.
This is a question for Dr. Pinsky. We hear a lot about people, I'm so sorry. This is a question for Dr. Pinsky. We hear a lot about people in the community who are positive for COVID-19 but have no symptoms. Can you talk about that?
Sure. There's been a lot of talk about asymptomatic and pre-symptomatic infections. And we know a little bit about this in the outbreak in the first nursing home in Washington State. When they identified the first case of a resident in the nursing home as well as an employee, they then went and screened all the residents and staff, and they found that among the residents and staff that were positive, there were approximately 40% that were asymptomatic. However, they did follow these residents over a week's time, and 80% of those residents became symptomatic after 1 week. So those residents were actually pre-symptomatic, the ones that became symptomatic. There was also a study out of Singapore where they do intensive contact tracing, and they looked at several outbreaks, and they determined that I can't remember the exact number, but something like 6 or 7% of the outbreaks were attributed to pre-symptomatic spread that occurred 1 to 3 days prior to onset of symptoms. So we know you can still be contagious before you develop symptoms. The question we don't know is that category of asymptomatic, at what degree are you contagious? And we don't know the incidence of asymptomatic versus pre-symptomatic?
We actually have a question coming in, similar question for Mayor Chirico, and then Mayor Morley. I think you can address the same question from the Elmhurst perspective, but questions about reopening businesses and who has the authority to reopen, in this case, Naperville businesses, and what metrics will we use in order to make that decision?
Sure. Yeah, good question. It's a hot topic right now on social media. The decision ultimately lies with the governor, of course, and his executive overrides any other mayors in the state. So we will give him information and input from our community, which includes DuPage and Will County Health Department information. Of course, the hospital information that we receive, which has been tremendous. We receive calls or contact 2 to 3 times a day. My office does from Edward, and then of course our first responder, our data tracking for COVID transports and that type of information. So all that information has been aggregated and given to the governor's office, so that he has a good picture of what's happening here locally. For me, one of the triggers that we continue to hear from both the governor and from the CDC and the president's team is that 14-day of decline in active cases, and so that's a number that we'll be tracking, and I would hope that that's a number we'll be seeing soon, at least in the DuPage County area.
Mayor Morley, do you have anything you wanted to add?
Yeah. First of all, I want to thank you for inviting me to participate today. We've all been faced with tremendous challenges of COVID-19. I take pride in our relationship with the hospital, and I'm thankful and supportive of your efforts to protect our community. At the municipal level, we are constantly evaluating ways in which we can provide services and relief to Elmhurst residents and business owners during this difficult time. We are prepared to protect our community and take measures to alleviate the burden that has resulted from this pandemic. Specifically as it relates to opening small businesses or businesses in general. But Mayor Chirico is correct. We kind of take our directions from above, and it's been a challenging time for the municipalities because whether it's an executive order from the governor or a law that's passed by Congress, this stuff is flying through so fast that they actually hand it down at our level and say, you guys figure out how to execute it. So that's very challenging. So Mayor Chirico mentioned about reopening, or that's what the question's about. It's our job to give as much feedback back through the pipelines and through the access that we have, whether it's through our state and state representatives and senators, our local county board members. I know Mayor Chirico and I have both been on, I bet we're on probably 2 or 3 conference calls a day, specifically with regard to how our municipalities are tackling this situation. And I would say that in the last 2 weeks, the ramp up from people who are looking to get back to normal, some sense of normal, has really increased. We don't have the power to flip the switch and allow businesses back on, but what we can do is feed our ideas and certainly the communication that we're getting from our local businesses, and that's what we're doing.
Here's a question that's come in via the chat box. Dr. Kandel, can you describe the test procedure and how long it takes to determine if someone is positive for COVID-19?
Sure. That's a really good question. Well, as Lou mentioned earlier, Edward-Elmhurst Health is one of the few hospital laboratories in the state with in-house capabilities of doing COVID-19 testing. We currently have 3 different molecular testing platforms for the coronavirus. The Abbott M2000, the Abbott ID Now, and the Cepheid Gene Expert. Although these 3 tests are similar in that they all detect viral RNA, they differ in regards to other factors, including what type of specimen type they need, what swab is required to collect the specimen, and how quickly we can get results after starting the test. Our Abbott M2000, which is our high-volume batch processor and has the capability of doing 94 tests at a time, takes approximately 5 to 6 hours to get results on 94 tests. The Abbott ID Now is a small single test instrument which can usually generate a result within 15 minutes of the specimen being loaded on the instrument. Our third instrument, the Cepheid Gene Expert, is also a small single test instrument, which takes about 45 minutes to generate our results after the specimen has been loaded.
This question was emailed in, and I think it would be appropriate for Dr. Sengal to answer it. Question about how do medical professionals decide when someone with COVID-19 is healthy enough to be discharged to home?
So, question is, when is someone healthy enough to go home? And it's really an approach that's, taken by the internal medicine physician and the care team. Typically involved in that is the internal medicine physician, maybe a physical therapist, a lung doctor, and an infectious disease specialist. What we're looking for is improvement in symptoms, the greatest symptom being shortness of breath, reduction in fever, and your overall oxygen requirements. As you improve, your oxygen requirements improve, and that's one of probably the biggest markers, along with some inflammatory markers that we see on blood tests that help us decide if you can go home or not.
Here's a question that's come in. I will start with Mayor Morley and then Mayor Chirico if you want to state your opinion on this as well. Should individual communities mandate the wearing of masks?
Okay, so the question is, should individual communities mandate the wearing of masks? That has been a large topic, a big topic, I'd say over the past couple of weeks. There's a handful of communities that I'm aware of that are mandating this in Illinois. I think it's 6 or 7 that I'm aware of at this time. That's a real difficult one. I personally think that it's something that should be encouraged in terms of folks wearing masks, but there's a real balance between people's freedoms and our ability to police this. It's a real delicate balance, and you could really run into some serious problems with a mandate like that. So right now, I would say in Elmhurst, we're encouraging everyone to do it. We continue to communicate that, but we're not in a position at this point to mandate it because I'm not sure that it would be as beneficial. The impact might be worse than the actual mandate.
So, Steve Chirico. Yeah, I think a couple of different thoughts on this. The first thing is that you've probably heard recently that a lot of the private corporations, national corporations, are mandating it themselves. We just heard yesterday morning Walmart, Sam's Club, Kroger, Foodstall are all requiring their personnel to wear it. So it's starting to happen naturally. And like we see in government, when once one major corporation takes this initiative, it has a little bit of a domino effect, and others will match because they look bad if they don't. So it might not be necessary. Certain industries, it won't be really possible. So for an example, in the restaurant industry, you certainly couldn't expect guests to be wearing masks if they're eating. So we're going to have some flexibility about how this works. But in terms of mandating it, here's my thoughts on that. I think that the governor likely will be providing us with a modified stay-at-home order within the next couple of days. And I suspect, and I would support, that part of that order will include additional protocols. And one of those might be that all employees in food stores wear masks, or those types of additional restrictions. So I think that there will be some compromise being done there, and it's going to have to be done on a industry business-to-business basis. But I think it'd be reasonable, at least at the beginning, to include that with the opening up of our economy again, until we know for sure that the caseloads are at manageable levels for the healthcare system.
I've got another question that's come in related to wearing masks, but I think it's more from an infection control perspective. what is the public benefit? Is there a public health benefit to people wearing masks? And if yes, under what circumstances should we wear them? So all the time, inside, outside?
Okay, great. Happy to answer that question. So there's two benefits. One is to protect yourself from someone else who is contagious, and the second benefit would be to protect others if you are contagious. Now, a little bit about the transmission of COVID. It's felt to be transmitted by droplets. So that would be not only through coughing or sneezing, but just through talking or singing, speaking, and they can be transmitted up to 6 feet. So and we do know, we just talked about asymptomatic state and pre-symptomatic state. So, you may not know you're sick and go to work, and then you could transmit that infection very easily without knowing it, even if you're conscientious and stay home if you have a fever, because you haven't had a fever yet. We do know that, for instance, we wear masks in the hospital for patients who are isolated in droplet isolation rooms. And when we go into the room, we wear the mask. The patient doesn't usually have a mask on, and that protects us from the droplets that the patient has. When we leave that room, we throw that mask out because that mask is now contaminated. Those droplets can get on my mask, and then I can contaminate myself if I touch my mask and then touch my face, for instance. So if I decide, I'm just being self-conscious and I want to wear a mask to protect myself, and I go to the grocery store and I'm the only person wearing a mask, that actually may be a problem, because the other people that are there, if they transmit their droplets to you, they can get on my mask, and then I could just contaminate myself, and it doesn't provide anything. So really, for this to work, you really need an all-in. You need really everybody wearing a mask, and then it will be effective. And it only needs to be done in a setting of a crowd. So you don't need to wear a mask outside. If you go to the park and the wind's blowing, you're fine. You don't need to wear a mask. But this would be in the setting of being in a building where you can't distance yourself more than 6 feet, or if you're in some kind of crowded environment. So I think that if there's a buy-in for people wearing masks, then maybe loosening some of those restrictions may be more feasible. But I think if we do that and people aren't wearing masks, I think that would be quite risky in my mind.
This question is for Leanna Plotke, one of our patient care directors. We've seen in the media that nurses are really taking a heavy hit from this. I mean, they're exhausted, they're working long hours. How are the nurses of Edward-Elmhurst Health holding up?
So this is Leanna. The nurses are truly resilient. They definitely are our heroes. If they're tired, they certainly don't show it when it comes to caring for their patients. They're committed to providing excellent care to our patients, and a lot of them which are alone and very scared. We have a rest and relaxation rooms throughout our inpatient units that have aromatherapy and guided imagery, so they can go in there and just take a few minutes to pause, rest, take care of themselves, and they're also practicing self-care at home also.
This is an interesting question. I'm not sure who will know the answer, but I'm sure someone will. Maybe Dr. Khatua will. Do we know of any instances of nursing home residents who have been treated as inpatients, and then are they not being welcomed back to their long-term care facility because they've tested positive? What's the situation with nursing homes?
Yeah, hi, this is Dr. Singal. We've recently seen an influx of patients from the nursing home community, and we have had success in treating and transferring these patients back to the nursing home that they were originally cared for. If we haven't been able to transfer them back to the original nursing home, usually we have some success in treating it to transferring to one of their partner facilities, which has a specialized unit for COVID patients.
Dr. Singal, are medications helping these patients or COVID patients, and what kinds of medications are helping?
Yeah, so pharmaceutical treatment remains an evolving topic. A lot of the things that you're seeing in the media are things that we are using, including the hydroxychloroquine and the azithromycin. And as we get more information, that the treatment is certainly going to change. One medication that we were fortunate enough to procure early on through this process was a medication that was approved in China called Actemra. That treats the inflammatory storm that's associated with COVID-19. We've had some relatively good success in keeping patients off of ventilators and improving their outcomes here at Edward. We've also recently started using some convalescent plasma and remdesivir as well at Edward.
This may be a good question for Lou. So we have, as a health system, canceled a lot of tests and elective procedures. Do we have any idea when we think it will be safe to start to reschedule surgeries and other kinds of procedures? Thank you for that question. That is the $64,000 question, which we ask ourselves every day. We do have There are some variables. We're watching the incidence of new cases, and as Mayor Cherko mentioned, we look for a decrease in new cases over a 14-day period before we would bring back services. That having been said, there may be some services that we were able to postpone a month ago that now need to be done. So we really look at on a case-by-case basis of what we can do now and what we can do safely. We'll be watching very closely again, the cases, but also the governor's order for shelter in place. And I do want to emphasize we have teams of people that are looking at specifically when can we bring back the full-on physician offices, when can we open our ambulatory sites, and when can we be doing elective procedures.
Here's another question for you, Lou. Do we feel the hospital has reached its capacity?
Actually, we did a lot of work on surge planning to be able to expand the capacity of both of our acute care hospitals. To date, we have not reached capacity. We still have plenty of room. Most days we operate at about 60% capacity as far as beds go. We also have capacity with mechanical ventilators.
I think this is a good question for Dr. Kandel. We're starting to hear a lot about antibody tests, and now we're also starting to see information on the news about antigen tests. Can you talk about antibody tests and antigen tests? What's the difference, and when do we think that they'll be available?
Sure. Yeah, that's a fantastic question. There are currently two main types of testing methodologies used for corona testing. Molecular tests and serologic tests. Now, molecular tests, which are sometimes also called antigen tests, they're used to detect the virus in upper respiratory specimens of patients suspected of having COVID-19. These are the tests that we have in-house at Edward-Elmhurst. Molecular tests are the only tests currently available for identifying infected individuals. These tests are therefore critical in identifying those individuals who need to be isolated so as to prevent the spread of the virus to others. Now, serologic testing, which some people call also antibody testing, is used to detect antibodies against coronavirus in a patient's blood. The presence of these antibodies provide evidence that the patient's been exposed to the virus. Now, there are different types of antibodies. The types which are tested for in the current serologic assays on the market include IgG, IgM, and IgA. Of these three, IgG appears to be the best marker to indicate exposure to coronavirus. However, although the presence of IgG indicates that the patient has developed an immune response to the virus, we don't yet know if this immune response will protect against reinfection. Now, the second question is, when will we have an antibody test? Because currently at EEH, we only have, we have 3 molecular tests, but no antibody or serologic assay. And in regards to when we will have an antibody test, that's a really good question. I wish I could answer. What I can say is that we do have a testing instrument in our laboratory that can run one of the serologic or antibody tests that's available in the market. We have been in very close contact with that manufacturer, and although they've made no promises, they hope to be able to give us some testing materials by next week. Once we receive the testing materials, we will have to do an in-house study to see if the test lives up to our expectations. And how long that validation will take, we really can't answer. But in best case scenario, if everything goes well, you know, we could have the test within a week of receiving the test reagents.
Here's another question for Leanna Plotke. How are we helping our very sick COVID patients deal with isolation? Because we know a lot of these patients can't have family visits.
It's very difficult to see the patients alone in the rooms. The nurses and our PCTs, they're very dedicated to spending time with the families. We also work very closely with our patient experience team, and of late we have set up a FaceTime capability. So if, like some of our patients that have been taken off of a ventilator and all they want to do is speak to their family, we have our patient experience team bring the iPad, and the nurses go in and set it up, and they're able to FaceTime with their family, and that has really lifted their spirits.
Are all COVID-19 patients in isolation rooms, or where are they physically within the hospitals, and are there enough isolation rooms to handle the volume?
This is Dr. Khatua. So yes, all COVID patients, positive patients, as well as rule-out COVID patients are put into isolation rooms. We have retrofitted many of our areas at both acute care hospitals with negative airflow to make those rooms a safer environment for not only the patients, but also the medical staff treating these patients. On top of all of that, a comment I'd like to make about lab testing, as well as supplies, as well as treatment algorithms, and how they all come in together, as well as placing patients into isolation in the right rooms. The ability that we have to turn around tests in a quick manner, and the fact that we have in-house tests, allows us to institute our treatment algorithms in a timely, quick manner and get the patients in the right setting at the right time, which I believe will lead to better outcomes overall. So I'm incredibly grateful to our staff and our teams at both acute care hospitals, Edward and Elmhurst, for being able to come together to create these algorithms, make sure we have all the right supplies, as well as the Herculean effort of retrofitting both acute care hospitals to manage a potential surge like we were expecting. So yes, we have the rooms, we have isolation rooms, but we've tied all that together in with all of our treatment algorithms, supplies, pharmaceuticals, and testing to make sure that our communities stay safe.
Here's another question for the mayors. I'll start with you, Mayor Chirico. Have you been having extensive conversations with other mayors at this time? How are you all working together? And then once you answer, Mayor Morley, if you want to jump in there.
Sure. I'm glad you asked me this first, because they'll probably be the same answers, so he'll be copying. The mayors do meet, I think, 3 times a week right now through Zoom meetings, and we share best practices, give updates to each of our fellow mayors about different things we're doing within the community, particularly with personnel and in terms of safety measures, and give an update on positive test rates and cases and things like that, talking about what's happening within the community in terms of attitudes and emotions, and how it's sort of shifting a little bit from initially being a very cooperative and collaborative, we're doing this for the team, to now being more anxious and more anxiety and more fear that we're sensing from people who are contacting us. And so, we're sharing that information and talking about how to, control the message of the best response, and make sure that we are demonstrating that our local government is operating, and we're operating with full service, and to keep people calm and confident.
Besides ditto, it's kind of I wouldn't call it a dirty secret, but, all of us mayors have a friendly competition between our towns, but we are, both Mayor Chirico and I are members of DuPage Mayors and Managers, also IML, a bunch of COGs out there, and we really do a whole lot of sharing So if somebody's having a particular problem, we've been doing this, ever since I've been elected. It was there, this infrastructure in place before I was elected. So it was a natural conduit when we faced this pandemic to have these meetings. So we have multiple meetings, not only the three that Mayor Cherico talked about. There's weekly calls, legal calls. There's calls with Mayor Lightfoot. So we're sharing a lot of best practices and learning a lot. We also get to see what everyone's home office looks like. And, all of our hair is grown out.
And I'll let the doctors in the room decide who wants to answer this, but we've been telling people that if they have symptoms and they feel like they can take care of themselves at home, they should do that. So how do we know when we should come into the hospital? What would be an indication of I'm now too sick to stay at home and take care of myself?
This is Dr. Khatua. In terms of how we think of COVID and the symptoms that you can have from COVID, obviously a fever and a cough are some of the initial symptoms that we see. That doesn't necessitate that you come into the ED. You can always call your doctor. That's always an option for you regardless of how you're feeling. But in terms of when you should come in or when you shouldn't, my recommendation is always call your doctor first, unless it's an emergency. At that point, you would call 911. We do have, if you go to our website, eehealth.org, we have a symptom checker. I think her name is Eleanor, which is part of our chatbot. So you can put your symptoms in and that will lead you to the right direction. We also have options with all of our physicians to either do e-visits or video visits. But you also have the option to call your doctor. So one of the key symptoms I believe that necessitates individuals potentially coming to the ER is progressively worsening shortness of breath. So if you look at all the symptoms you would have of a common cold, if you're starting to feel short of breath, you should call your doctor. But if it starts progressing quicker, you either go to the ER or you call 911 at that point. But you have a multitude of options of contacting your physician. And if you don't have a physician, like I said, you can go to our website, do the symptom checker, or do a video visit or an e-visit or a phone visit with a physician at any time.
Okay, here's another question for you, Dr. Khatua, or Lou, if you want to jump in here too. Are staff getting sick? I mean, are we worried about not having enough staff?
So this is Dr. Khatua. So as we looked at our surge planning and as we did research as to what was going on in Washington, New York, and the rest of the world, we looked at, the potential impact to our own employees. So everything that we've done in terms of creating personal protective equipment guidelines, we have a multidisciplinary team that includes physician leaders at both hospitals, the chief medical officers at both hospitals, the chief nursing officers at both hospitals, as well as our supply chain, to kind of look on a weekly basis as to what is our supplies, what is the science showing, what's new, and how do we adjust and pivot our guidelines to make sure that our employees stay safe. Now, when we planned for our surge, we looked at, what would our staff look like if 20% of our patients or 20% of our employees got sick? So yes, have there been employees that have gotten sick and tested positive for COVID? Yes, we have a process to contact trace and look and see where they could have potentially been impacted or gotten COVID, and we do each one on an individual basis.
I love this question, and actually I'm going to twist it a little bit for Dr. Pinsky. So the question is, what should we be doing at home to protect ourselves and our families? But I'd like to know, since you're an infectious disease specialist, what are you doing at home to protect yourself and your family?
Good question. I also on the microphone. Before I answer that, I just want to add something about the question about the isolation rooms, because a lot of people don't know what isolation rooms are, and I just want to explain a little bit what that is. Every bed at Edward Hospital is in a private room. So if someone gets admitted and either diagnosed with COVID or is being tested for COVID, they go into one of the rooms, which are all private. Door is closed, and staff have to wear the appropriate personal protective equipment to go in that room. So the question comes up, if you're being tested for COVID and then you go to get admitted to the hospital, Is there a concern you may be exposed to someone else who has COVID? Well, not really, because you'll be in your own private room. So it's not like an open unit that you see on the TV where there's a bunch of beds in one corridor. These are all private rooms. So there's no way that that anyone can transmit something to someone else from room to room. That was just one thing, because there may be some misconception. So as far as keeping yourself safe at home, you know, obviously you want to limit your contact in the community. I myself, I have to go to work, so unlike everyone else that's staying at home, I do go to work. And when I go to work, I wear a mask. Everyone else at work wears a mask. So if any of us have COVID and we don't have symptoms, we're wearing masks, so that helps protect us. When I eat lunch alone. I spread away from anyone else that I'm with. And then, of course, when I see patients in the hospital, if there is somebody's getting ruled out for COVID or has COVID, we have to wear gowns, gloves, goggles, masks, wash our hands before and after. And when we see any patients, we're wearing masks and we wash our hands before and after any care. And then when I go home, of course, the concern is what could my kids bring home to me and so forth. So my son never goes out. He stays home. He has no contact with his friends. He is on FaceTime with his friends. And my wife has to go shopping. She goes to the grocery store. She wears a mask when she goes to the grocery store. And I've told her that she has to, you know, clean that mask after she comes home, and it's a cloth mask. And then, you know, we do keep our distance at home. You know, even though none of us are sick, it's just an extra level of precaution. I think that's a personal decision. I mean, if you have children, obviously you have to provide intimate contact. You know, you're not going to stay away from a child who needs a hug, obviously. But, you know, I'm just using some common sense.
Here's a question for Mayor Morley. The Elmhurst City Council approved and passed an ordinance that has granted you the ability to make executive orders with the intent of lessening the hardships that have transpired due to the spread of the virus. How have you used this, and will you continue to expand on it?
Okay, so that's a good question. Normally, the way we function in Elmhurst.
Normally, the way we function in Elmhurst is we have 14 aldermen, and we have public meetings. And usually, if something's being voted on in Elmhurst, it's been going through quite a process. Sometimes many months before it goes through. It's an idea, it goes through committee, comes up to council, we vote on it and discuss it, and people are very prepared and understand what we're facing. But as I mentioned in a previous answer, we're getting executive orders and other stuff passed down to us from higher up, whether it's the state or federal levels, and we have to interpret some of those things. In addition, we don't always have the time to hold a meeting to do certain things. So, for example, one thing that relates directly to Edward-Elmhurst is at one point, I know the folks here were concerned about potential emergency daycare for your workers who could not necessarily count on their normal daycare and might need to expand it somewhere. So I had the authority, without having to write a report, write a law, write a resolution, I had the authority to waive all of the necessary requirements to establish a temporary daycare at one of our local schools. So that's a benefit. But really what it's there for is so that the city of Elmhurst has the ability to react in response to the virus. So it's not like I'm approving building contracts or cutting deals with the unions and, you know, structuring four-year contracts with the stroke of a pen. But as it relates to any response to COVID-19, it allows us to be nimble in our response and to, you know, safely operate as a city on behalf of our residents.
Dr. Sangal, we hear a lot about ventilators and the numbers of patients that need to be put on a ventilator. Is being put on a ventilator a sign that that's very likely that patient won't recover? Or are we seeing patients successfully come off of a ventilator and get better?
Yeah, so not necessarily, I mean, being on a ventilator certainly carries a higher mortality risk. Having said that, we have actually been quite successful in removing patients from ventilators at both Edward and Elmhurst Hospital. However, our goal remains to keep you off of a ventilator. We've got multiple strategies in place, including, prone positioning, which is when you're lying on your stomach. We also have our patients do breathing exercises on an hourly basis. And as I previously discussed, we have certain pharmaceuticals that have been approved in China and anecdotally that we've used here that we've had good success with in keeping patients off of ventilators.
Dr. Pinsky, we've heard a lot in the news this week about this second wave they keep talking about coming during flu season and how it's going to be even worse with COVID. Can you speak to that?
Well, I'm a clinician. I'm not an epidemiologist, and I have to listen to what the experts are saying. So we really can't predict that. But I guess the concern is, if we look at other models like influenza, in the 1918 pandemic, they did have a second wave. I think in the fall and winter. So as we don't know with this virus if it's more likely to be transmitted in cold climates, and I guess it all depends on how many infections we have and what the numbers are. The less number of people that are infected, then the less likely that that's going to escalate. So I think it's really difficult to predict it.
I think this is a question for Lou. Are there any financial concerns as Edward-Elmhurst continues to successfully treat hundreds of COVID-19 patients? If yes, where are those financial impacts occurring and how are we going to recoup?
That's a very good question. And yes, there have definitely been financial impacts. You may have read that that's going on in hospitals across the country. We've seen roughly a 40% reduction in our revenues because we stopped doing elective procedures, less patients coming to the physician offices, or fitness centers are closed. So we have already begun to change some of the ways we do things to offset those reductions in revenue, and that includes relooking at, where we're spending money, how can we be leaner, looking at our capital expenditures and delaying some of the projects that we have going on. So that's the bad news. The good news is that we do have a stimulus bill that is available to help reimburse us for some of the losses that we're sustaining through COVID-19. We anticipate we'll get money from the federal government as well as FEMA, which is the Federal Emergency Management Association. And so we are applying for any and all grants and monies that we will be able to recoup some of our losses.
Is it true that nurses and other staff are having to reuse the same masks over and over? Maybe Leanna, you could talk to that.
Sure, I'm happy to answer that. We do reuse our N95, but we have a process to clean them. So the nurses put their masks on with clean gloves, and after they provide care, and then they're taking the masks off with clean gloves to reduce the risk of contamination. And at the end of their shift, we have a sterilization process that we follow. So the masks are put into sterilizing bags, clearly labeled with the staff's name and ID number, and then they go to be sterilized, and then they're returned to the unit the next day for the staff use. But at any point, the staff know that if their mask becomes compromised, that they are to discard it and get a new one.
I'm going to ask, I think we're headed up on the 5 o'clock hour, and our WebEx will kick us out. So I'm going to ask one more question, and I think I'll ask it of you, Lou, and then let you wrap this up. So I have a friend of a friend who told me a story about her a husband, a man in his 30s who was having chest pain, but he was afraid to go to the emergency room because he didn't want to catch coronavirus. And he unfortunately had a heart attack at home and died. What is your message to the community when it comes to being afraid to come to the emergency room?
I'm so glad that question was asked. Here's what I want to say to the community. If you need to come to the hospital, it is safe. We are here. We stand prepared and ready to take care of you as we always have. And the reason for social distancing and some of the anxiety around coronavirus is because it's so contagious. And so it can spread through the community quicker. And we were concerned when that happens that we would have a surge in patients within the hospital. But what you need to understand is that we have always taken care of patients with infections. We have safety protocols designed and executed nearly perfectly to prevent an infection from spreading from one patient to the next. And so those protocols will remain in place. And it is totally safe to come to the hospital. What is not safe is to ignore symptoms that are problematic, whether it's abdominal pain or chest pain or anything that under normal circumstances you would come to the hospital for. You still need to come to the hospital. As Dr. Khatua said, if it's an emergency, you may need to call 911 or you can come through the emergency room. But we have all the protocols in place to protect you. That's what's important to know. I want to comment on something that that Mayor Morley said about the healthy competition that exists amongst municipalities, and we have the same thing here. We have healthy competition, but when it comes to patient care, not so much. We have been incredibly collaborative with all of our colleagues in healthcare, those that are close neighbors to us, those in Illinois, those across the country. We are openly and transparently sharing all of our protocols, all of our algorithms, every tip and trick we learn, and certainly many of the things that we've done at Edward-Elmhurst are because someone else shared those tips or tricks with us. And so as a community, and I mean a community of healthcare workers, we have come together around this in a way that I think is just really as it should be, but also beautiful to watch. And someone asked if we had enough staff. We do have enough staff. We have a lot of employees that worked in some of the areas that were closed, and we have been able to redeploy those people to work in other departments. And I think it's always got to look for the silver linings, but one of the silver linings in this pandemic has been that we have had the opportunity to teach people new jobs, new skills. We've had the opportunity to, over 100 nurses have received an orientation and education about how to help and take care of patients in the intensive care unit and how to help take care of patients within the hospital setting. So there are learning new skills, and we do have the staff. The other thing that's been incredibly heartwarming really to watch is that people have moved from their home department to other departments and are jumping in and doing whatever it is that needs to be done to take care of patients. So if that means today, yesterday I was a diabetic educator, and today I am helping clean respirator masks so the staff have them available, then that's what's happening. And the camaraderie and the teamwork and that willingness to help each other out has just been a true blessing. And I think the staff have even, as we make rounds, what we hear from the staff is that how welcome they feel when they go to another department, how much they're learning, and how grateful they are to be able to be working when we know so many people are not. All right, 5 o'clock? All right. Thank you so much for joining the call. Thank you for your questions. And remember, if you have if you want any additional information about coronavirus, go to eehealth.org. We have a lot of information there for all of you. And I would like to thank all of our speakers today for joining us, especially Mayor Chirico and Mayor Morley, who came across town to be here. Thank you.
Lou, if I can just add real quick.
Yes.
Mayor Morley and I were discussing how fortunate we are to have the Edward-Elmhurst Hospital system in our two communities. I mean, it is truly, you always appreciate it. But you certainly can appreciate when you have a situation like this to have such quality health care. And I just want to say thank you to all of the doctors, nurses, staff, everybody for really keeping us safe. We're so appreciative.
Thank you, Steve.
Oh, well.
I too reiterate the sentiments that Mayor Cherico mentioned, and it is really unique for our communities to have world-class healthcare in our backyards, and I know that that's part of the reason that our residents live where they do, choose to live where they do, and you're an important part of it. When I give my mayor speeches, I talk about the crown jewels of Elmhurst, and certainly Edward-Elmhurst Healthcare is a big part of that and a valued partner.
Thank you. Thank you, Mayor Cherico. Thank you, Mayor Morley. Thank you for everything you've done to help support us throughout this process. And I do want to mention that although you both have executive powers, and although I've asked you multiple times to open the hair salons, here we sit. Thanks, everyone. Have a good evening.